Hello, and thank you for joining us on Loving Akhilesh Reflections of Parenting a Child with Severe Learning Disabilities, Episode 1. My name is Dr. Srilekni Kadari, and these podcasts are based on an interview with my mother. She will be sharing her parenting experience in looking after my brother who has severe learning disabilities. Having just become a mother recently, I wanted to get to know my mother's parenting journey. Being in COVID lockdown and on maternity leave, I had extra time to spend with her. When I was pregnant, I remember reading an affirmation by Kevin Heath. As our kids grow, they may forget what you said, but they won't forget how you made them feel. We thought it would be nice to share our experience with others of all age groups, including parents with a child diagnosed with or without a disability, to help spread awareness and respecting families who care for a child with special needs, as well as highlighting that a parent's job is to not cure the disability, but to give your child the best physical, mental, spiritual and social environments for them to work through their challenges. In our first podcast, we'll be talking about Akhilesh's birth history and diagnoses made during his infancy. I'll also be speaking about what it means when we say learning disability or special needs, and we'll be explaining briefly about medical conditions, including cerebral palsy and epilepsy. To begin with, Mum, can you tell us a little bit about yourself and Akhilesh to our listeners?
Hello, my name is Dhanlakshmi Kadari and I have two children, Srilekni and Akhilesh. We've been living in the UK for more than 20 years and now settled in Ipswich. I am full-time mom and the main carer for my son. Akhilesh is 25 years old and was born in Vizag in India. He graduated from Applefield Secondary School in York in 2015 and has been attending daycare centers on a leisure basis since then. He has multiple diagnoses including cerebral palsy, lissencephaly, obstructive sleep apnea, epilepsy, scoliosis, gallstones, and impaired vision, all of which contribute to his severe learning disabilities. His cerebral palsy and epilepsy were diagnosed in his infancy, and the rest later on in his life. He has always been bedbound and is 24 hours dependent on another person for his personal care. Despite his age, he has always been like a newborn in the past 25 years. He cannot walk, talk, and chew. He lacks mental capacity to understand, communicate, and make decisions. However, he can express his emotions with facial expressions, giggles, laughs, and cries. He is just like everyone else with likes and dislikes. He enjoys Zumba music, sensory lights, eating sweet puddings, listening to stories, going to the movies, parks, and swimming. He hates sour foods and drinks. The beauty of Akhilesh is that on any normal day you would not expect him to be different to any other person. He has his own thoughts and feelings, dreams and achievements, friends and family despite his learning disabilities.
Thank you, Mum. I agree. Akhilesh is just like any other kid once you get to know him. Discovering your child has special needs is often a difficult process. It can be confusing to understand how much of the behaviour is because of the nature of the condition and how much is not. Can you tell us about Akhilesh's birth and how he was diagnosed?
Yes. When I was pregnant with Akhilesh, there were no red flags and his birth report states that the birth was uneventful and no concerns were raised by the doctors. It was a normal delivery and he was bottle fed and breastfed. He fed well and slept well. You couldn't tell there was something wrong with him when he was a newborn. By the end of his 5th month, we noticed delays in his milestones. He had no head control and could not roll over, grab things, or crawl. We were worried and consulted the pediatrician, who further investigated him with blood tests and scans. They confirmed that his developmental delays were because of his cerebral palsy and was given a prognosis of 5 to 6 years of age. Living in a community with a poor awareness of learning disabilities, it was the first time we were hearing about this diagnosis. We were shocked and completely devastated with the news. We did not expect it to be so serious and at least hoped for a cure for such a bad prognosis, but sadly not. It was a moment in our lives that hit us hard because, as parents, we never expected something like this to happen to us. Honestly speaking, we were lost for words.
I'm so sorry that you had to go through such a difficult moment in life. I can't even begin to imagine how hard it must have been for you and Dad at that time. How did you cope and manage his condition thereafter?
We are lucky to have a big, loving, and supportive family. They were also shocked upon hearing the diagnosis and were curious to know about cerebral palsy, something they never heard of before too. When I realized that my worries and fears were affecting the care of my children, I started to move on by finding out ways I could support them so that they could lead their lives as normal and enjoyable. Since then, my whole lifestyle and persona had changed and was molded to create a better and positive environment for my children. As part of his treatment for cerebral palsy, the doctor had advised physiotherapy to help with Akhilesh's mobility of his joints so that they don't become stiff and immobile later on. Since then, we had been doing physiotherapy for him on a daily basis and later on started using splints for his hands and feet. When we started weaning him, he continued to feed well with smashed up foods, but by the time he reached a year, he started having regular twitches and jerks. We were informed that his twitches are due to his new diagnosis called epilepsy. I still remember his first episode of seizure where his mouth was twitching to one side and I was in utter shock because it was not something I've seen before in children. I was petrified because I did not know how to stop it. We soon started his anti-epileptic medication, which he has been continuing to take till this day. We even researched about the facilities we could provide for Akhilesh in our area. At that time, there were no schools or daycare centers for children with learning disabilities. There was a poor outdoor access for wheelchair users for him to travel as well. I did not like the idea of keeping him in the house forever just because he had no facilities to support him. He is just like everyone else, and I always believe he deserves the same equality and respect in his living despite his learning disabilities. When we found out that we could provide more facilities elsewhere, especially in the UK, we finally decided to move there for a better living.
Thank you, Mum, for sharing your experience during Akhilesh's birth and childhood. Early recognition is the key to identifying and diagnosing children with learning disabilities. As shared in my mum's experience, Akhilesh's delay in his milestones was a trigger for her to go to the doctors, and most of the time the parent, often the mother, may notice this as the only sign in their child. Having a diagnosis with learning disabilities can also be hard and stigmatizing on a family. A supportive network of family and friends can be great, and in the recent years, there's been an increase in awareness of learning disabilities. There are now a lot of online resources, including forums, articles, and blogs, and social support groups for parents with a child with learning disabilities to get together, share their experiences, and give each other tips, ideas, and hints. I will now be talking about the following medical terms mentioned in this podcast: learning disability, cerebral palsy, and epilepsy. A learning disability as quoted on the NHS affects the way a person understands information and how they communicate. This means they can have difficulty to understand new and complex information, learning new skills, and coping independently. Around 1.5 million people in the UK have a learning disability, and this figure is rising as I speak. Learning disability is classified into 3 types, as mild, moderate, and severe, according to how much it impacts on activities of daily living. Some of these disabilities are diagnosed at birth, as in my brother's case. A disability can be caused by family inheritance, infections, injury, and insufficient oxygen supply to the brain during birth. Cerebral palsy. Cerebral palsy, as quoted on the NHS, is the name for a group of lifelong conditions that affect movement and coordination. It's caused by a problem with the brain that develops before, during, or soon after birth. Symptoms like delay in developmental milestones, seeming too stiff or floppy, being fidgety or jerky, having speaking and feeding problems are noticeable during the first 2 to 3 years of life. Causes of cerebral palsy are similar to the causes mentioned for learning disabilities. Physiotherapy, speech therapy, medicines, and occupational therapy are some treatments which can be used in cerebral palsy. In terms of the outlook for cerebral palsy, it's difficult to predict because it affects each person differently. Centre for Disease Control and Prevention states from recent population-based studies from around the world that cerebral palsy ranges from 1 to 4 per 1,000 live births, and the prevalence is higher for preterm or low birth weight babies. Scope is the main charity in the UK for people with cerebral palsy and their families. If you or your child have been diagnosed with this medical condition, or know someone who does and would like to suggest it to them, then you may find it useful to contact Scope for information and advice online by telephone on 0808 800 3333 and via email at helpline@scope.org.uk. Epilepsy. Epilepsy, as quoted on the NHS, is a common condition that affects the brain and causes frequent seizures. A seizure is a sudden burst of electrical activity in the brain that temporarily affects how it works and causes a wide range of symptoms. In Akhilesh's case, epilepsy started at 1 year of age, but it can start at any age and is lifelong, but can get better later on in life sometimes. The World Health Organization states that around 50 million people worldwide have epilepsy, making it one of the most common neurological conditions globally. When a seizure occurs, there can be uncontrollable jerking and shaking, which is sometimes referred to as a fit. You can sometimes get strange sensations, become stiff, or collapse and not remember what happened. NHS advises anyone to call 999 for an ambulance if someone is having a seizure and it is their first time, or when the seizure lasts for more than 5 minutes, or when they have breathing problems. Epilepsy is usually assessed by a neurologist and treated with anti-epileptic medication, which may be used lifelong or until it resolves. Other treatments may involve brain surgery, a special ketogenic diet, or putting a small electrical device in your brain to control the electrical activity. It is not clear as to why epilepsy occurs, but can be caused by brain damage due to infection, trauma, stroke, tumour, and drug and alcohol misuse. Epilepsy is usually a lifelong condition, but most people are able to still live their lives if their seizures are well controlled. We have now come to an end for episode 1. We hope you had enjoyed listening and maybe learnt a few facts about learning disability, cerebral palsy and epilepsy. Thank you for listening, and please join us again in our next episode where we will be talking about my mother's parenting experience with Akhilesh after moving to the UK. Hello and welcome back to Loving Akhilesh, Reflections of Parenting a Child with Severe Learning Disabilities, Episode 2. In the last episode, we talked about Akhilesh's birth and how he was diagnosed in infancy to highlight the importance of early recognition and intervention. I also spoke about learning disability, cerebral palsy, and epilepsy. In this episode, we will be discussing about my mother's parenting experience with Akhilesh when we first moved to the UK. Travelling and relocating can be a difficult process for parents with a child with or without a learning disability. It can take time to get to know your neighbourhood and research about the facilities available for your child. The logistics of travelling can also be a struggle, especially if there is a poor wheelchair facility. Can you describe how it was like for you when you moved to the UK for the first time, Mum?
We moved to the UK in 1998 when Akhilesh was 2 years old and been living here since then. The year before our move, Akhilesh's visa application got rejected because of his diagnosis and learning disabilities were thought to be contagious, which are not. So we reapplied with a doctor's note clearly explaining that his cerebral palsy and epilepsy does not spread to other people. The rest of us approved, but I decided not to come when my son's visa got rejected and stayed back until it got approved. When relocating to a different country and you require a visa, I would advise for parents to please make sure that your doctor clearly documents about your child's diagnosis in detail to avoid rejection as in Akhilesh's first visa application. Once we moved to the UK, I was nervous and afraid because it was the first time I crossed another country and the culture and lifestyle here is very different to that of my home place. We had no clue where to start to arrange Akhilesh care. We first registered with the nearest doctor's surgery, the general practitioner GP, then referred him to the NHS hospital doctors to reassess his health and needs. His medical investigations concluded a new diagnosis and the pediatrician concluded that he had Lissencephaly. The GP also referred him to the health visitor to assist with his personal care, including arranging long-term supply of continence pads and wheelchair transport at free of cost. She also referred him to special needs school, daycare centers, and respite care in hospices and care homes where Akhilesh can enjoy with other children. As he grew older, more healthcare professionals were involved for his healthcare management.
It seems like it wasn't an easy transition then. How was it like being for you since then?
After a few years had gone by, my husband had to relocate to different places because of his work, and so I was looking after my children on my own. This was difficult time for me because I was still getting used to the place and I struggled to manage looking after the house and both of my children, especially with Akhilesh, who requires constant support for his personal care. He had started to get taller and heavier as well, and so required at least 2 people for moving and handling him. My daughter supported me since her childhood at these times. She would help me look after the house and Akhilesh as she grew up. At those moments, I felt blessed to have such a loving daughter like her and felt Akhilesh was lucky to have a sister like her. Because of my daughter, as time went by, I became stronger and felt confident that I could manage looking after Akhilesh and create a good and enjoyable environment for my family. Soon we started going swimming, shopping, walks, to the cinemas, and more together. There was wheelchair access outdoors and transport with wheelchair lifts, so we were able to go all together and spend good quality time. During holidays, we would even travel with Akhilesh locally and abroad. He has been to India every year during summer holidays to spend time with his grandparents, cousins, aunts, and uncles. He has even been sightseeing in Europe and America. Traveling long distances and in the flights had gotten difficult with time because of his scoliosis. He struggled to sit properly for long periods of time. The flight seats and wheelchair access to transport him onto the flight seat did not support his spine well. It was difficult to lift him up to be placed on the flight seat, as well because he started to get heavier and at least two flight assistants were required to carry him. During the security screen at the airport, it was a hassle every time in lifting and carrying him until his wheelchair was scanned through. However, he is still able to travel short distances in cars or long distances in cruises.
Thank you, Mum. I remember enjoying the trips we had with Akhilesh. What was it like for you with others in the community here?
We are grateful to also make good friends here, who more likely family to us now. They had been very supportive with Akhilesh and would invite him to parties and outdoors so that he could enjoy with other kids. Whenever we would take him out, I could see him becoming more interactive with his surroundings and people around him as well. He listened attentively to outdoor sounds. He laughed more often and would look around excitedly every time when we took him out. With good facilities and supportive friends in the community, I realized that was when we made the best decision to move here. As a family, we were happier and settled well in the community.
I agree. I'm grateful too for the lovely and supportive friends we made here. Would you like to add anything else?
Yes. Once we got our permanent residency, we were also eligible for benefits for Akhilesh to help support his personal care, such as an unlimited and free supply of incontinence pads, carers support, disabled car parking permit, food and leisure discounts, and CEA card which allows whoever is accompanying Akhilesh to go to the cinema free. Whenever we relocated within the UK, it would take time to arrange his care, but it was not impossible. Once we gathered our resources to support us in caring for Akhilesh, I felt like I could travel and live anywhere with him in the UK and elsewhere.
Thank you, Mum. Can you tell our listeners about your career growth in the UK as well?
In 2006, I even completed my MSc in Computer Studies at Essex University and worked in different companies since then, both of which I thought I would not be able to do so far. I am lucky to have such a supportive family to help me grow my career. Having a child with or without learning disability does not have to stop you from pursuing your career or dreams. Although at times it may be difficult to balance work and home lives, when you have a child, it is not impossible to have both. There are schemes for parents who may find in a struggle to learn or work full time, for example, remote working, flexible hours.
Thank you, Mum, especially for sharing your experience when you moved to the UK. I'm touched by how I made you feel positively at those difficult times as well, and how the whole process sounds so enlightening. It seems like you went through a lot when you first arrived here, which was more than 20 years ago now, but managed to get where you are now by being patient and taking a step-by-step approach. It's also amazing how you make it sound like nothing is impossible, which is something I wanted to convey to our listeners. Whether you stay or move to a different area, take your time to research thoroughly about the facilities around you to help create the best environment for your child. What advice would you give to parents with a child with a learning disability if they want to relocate as well, like you did, Mum?
If you are relocating to a different area and have a social worker assigned for your child, I would recommend taking their support to help arrange facilities for your child in your new place before you move in. The social worker can help arrange any carer support and benefits beforehand so that you don't need to wait until you move in and then make these arrangements, which usually take a lot of time.
Thank you, Mum. That's a very helpful advice for parents. I would like to also touch upon Lissencephaly really quickly, which my mum had mentioned earlier. Lissencephaly, as quoted in the National Institute of Neurological Disorders and Stroke, literally means smooth brain. and symptoms include failure to thrive, seizures, difficulty swallowing, and deformed joints. The prognosis is poor, and most children pass away before they reach even the age of 10 years. There is no cure for this diagnosis, but supportive treatment such as comfort, nursing, and feeding interventions can help slow down the prognosis. In Akhilesh's case, his doctors, to this day, are surprised that he has also reached the age of 25 years and ongoing as a happy child. We have now come to an end for episode 2. Thank you for listening. We hope you enjoyed this episode and learned a few facts about Lissencephaly too. Please join us again in our next episode, where we will be talking about Akhilesh's care plan to get an insight into the healthcare professionals involved for his health and social care management. Hello and welcome back to Loving Akhilesh, Reflections of Parenting a Child with Severe Learning Disabilities, episode 3. In the last episode, we talked about my mother's parenting experience with Akhilesh when we moved to the UK for the first time, and the difficulties parents can face when relocating or travelling with a child with or without a disability. In this episode, and in the next one, we will be discussing about Akhilesh's care plan in detail. In this episode, we will be just focusing on his healthcare plan, and in the next one, his social care plan. It is good practice to have a care plan for a child with learning disabilities, especially when they have difficulties to communicate their needs or requirements. People looking after the child can read their care plan in order to help take care of them. Mum, can you please explain to us Akhilesh's healthcare plan, including the healthcare professionals involved?
Given Akhilesh complex needs, he had many healthcare professionals involved in his healthcare plan. We would contact his general practitioner GP in the community for any concerns, and they would kindly come home to assess and treat Akhilesh because it is difficult for him to travel to the practice. If they feel it needs further management, they would sometimes blue light him to the hospital in emergencies. Until he reached the age of 18 years, he used to have his own pediatrician, whom he used to visit every 4 months at the outpatient clinic in the hospital. The pediatrician would assess his medical health care in detail according to his needs, such as anti-epileptic medication, and would refer to other healthcare professionals when necessary. For example, he referred Akhilesh to the orthotics because of his dislocated hip joints, which had gotten progressively worse and caused scoliosis. All of this caused him to not stand for long periods of time, and eventually he could only sit or lie down and cannot even stretch his legs. Unfortunately, we were informed that they could not surgically correct it. We were able to also contact the pediatrician secretary to see him in between his regular appointments if necessary. We were so thankful for such as a lovely pediatrician for Akhilesh.
Yeah, I remember his pediatrician. He was very good with Akhilesh and was also an inspiration for me to work in pediatrics when I was a junior doctor. Can you let our listeners know how his scoliosis progressed further?
His scoliosis had started to bring his right hip and rib closer, which was compressing his lung at the same time. This reduced his lung capacity, and when he lies down, his airways were also being affected because of his tongue blocking it. His breathing difficulties had worsened over time and resulted in sleep apnea. He sometimes required home oxygen support to help relieve his breathing, but even then it is a struggle to use this equipment or CPAP because he doesn't like to keep the oxygen mask on. His district nurse and GP are involved for his home oxygen treatment, including arranging oxygen cylinders and teaching us and the carers how to use them. Because of his lung conditions, he is also involved with the chest physician at the hospital. They monitor his condition by regularly reassessing his lung capacity. There is no cure for his lung condition and is supportive in nature, including comfort, nursing, and oxygen therapy.
It's astonishing how his scoliosis had later impacted his joints and lungs. This is a good example of how one medical condition could lead to other complications. You mentioned district nurses earlier. Can you please describe what else they do for Akhilesh and any other healthcare professionals in the community who also provide care for him?
District nurses also help Akhilesh in providing incontinence pads, taking blood tests at home, as well as arranging oxygen cylinders. They are referred by the GP and provide regular care for patients in the community. Dentists were also involved with Akhilesh's care because he struggles to maintain his mouth care. All his teeth had decayed later on with age, and because he cannot chew, they were also growing incorrectly. The dentist extracted all his teeth under general anesthesia. He later grew wisdom teeth, which now needs removal too. A social worker is arranged by the council for any child with learning disabilities or a clinical care coordinator by NHS Clinical Commissioning Group if the disabilities are severe. They assess the child's needs and help with healthcare management accordingly. Akhilesh's social worker and care coordinator helped arrange his carers for regular support in his personal care. Referrals to respite care homes, special needs school, daycare centers, and hospices, as well as free transportation with wheelchair lifts for him to travel to these sites. Because of his disabilities, they provided funding and benefits for Akhilesh because he could not ascertain a normal education or a working job to earn for his own living. Because of his speech, swallowing, and mobility problems, they had also referred him to the occupational therapist, physiotherapist, and speech and language therapist as well.
Sometimes we may think healthcare is just provided in hospitals, but it's amazing how much care is provided in the community as well for continuity of care. Can you please describe how the last few professionals you had mentioned are involved in his care as well?
Speech and language therapist assessed Akhilesh's swallowing, including conducting video fluoroscopy tests. Because of he cannot chew and had difficulty in swallowing, he is at a high risk of aspirating his food, which can lead to pneumonias. She had helped create a care plan for his feeds, including a special diet like high in fats and carbohydrates, using a thickener in his foods for consistency. How he feeds, such as mashed up foods with a certain spoon in a certain way. He needs to be positioned in a certain angle as well for him to swallow his food and drink easily. And it was important to note that it takes time, at least 30 minutes, to finish his meal, so we had to be patient. She had offered alternatives such as PEG feeding, but this was declined because he is able to still feed orally, is gaining weight, and so it was not required. The occupational therapist helped us arrange Akhilesh's equipment at home. They assessed the house and arranged ramps to help him to move in and out of the house using his wheelchair. They also built a ceiling hoist to transfer him from his wheelchair to his bed and a mobile hoist which can be used to transfer him from one room to another. Akhilesh also required a special bed because he was bedbound, and so to avoid pressure points, a special foam mattress, air mattress, and adjustable bed was recommended. Likewise, the therapist had arranged a special bath chair for bathing, splints for his hands and feet to help with his joints, and sliding sheets used for moving and handling him. The physiotherapist deals more with Akhilesh's mobility. Because of his scoliosis, they had created a special wheelchair which accommodates his curved spine. They had also arranged a sleep system to place Akhilesh in a straight position when he is on the bed. For example, pillows on his right side where the spine curves and pillows under his bent legs. Exercise were also recommended for Akhilesh, such as hydrotherapy or swimming, which he enjoys a lot. When he was a child, he could stand, although for a short period of time, by using a standing frame provided by the therapist.
Thank you, Mum. I'm very thankful for the multidisciplinary approach to Akhilesh's complex care management. It's fascinating how little changes like wheelchair, bath chairs, special bed and splints can make such a huge difference to a child with learning disabilities when we make a better environment for the child. We have now come to an end to episode 3. We hope you enjoyed listening and maybe given a new perspective, understanding and respect into the NHS multidisciplinary and holistic approach to healthcare management. Thank you for listening, and please do join us again in our next episode where we'll be discussing about his social care plan. Hello and welcome back to Loving Akhilesh, Reflections of Parenting a Child with Severe Learning Disabilities, episode 4. In the last episode, we talked about Akhilesh's healthcare plan. In this episode, we will be speaking about his social care plan and carer support. Since the past few years, there had been advancements in the facilities socially available for people with learning disabilities, such as disabled parking, wheelchair access in public transport or public places, support groups, and more. Mum, can you please speak about Akhilesh's social care plan?
The social worker had helped us arrange respite care or hospices and daycare centers for Akhilesh. He would go on sleepovers for 40 nights a year and attend daycare on a regular basis. Akhilesh was also attending special needs schools as well when he was young. They carried out social activities and would take him out on trips including cinemas, beach and shopping. Once he reached the age of 18 years, he would go to care homes and other daycare centers with people of his age now that he is an adult.
Thank you, Mum. I remember attending some of these activities with him. They would sometimes arrange activities for siblings as well, and it was good fun. Mum, you had touched on carer support previously, but can you please explain to our listeners how they support you with Akhilesh?
Akhilesh is completely dependent on 2 people for his personal care at day and night. The NHS care coordinator had arranged carer support to help me look after him. Before he used to go to school, but now he is based at home and would only go out on a leisure basis. So I needed more support since then to look after him at home and when we take him out. The carers would help me in moving and handling Akhilesh on the bed and in his wheelchair. They also help me bathe him, nappy changes and feeding. Sometimes they help administer medicines and accompany him in his playtimes. We would train them according to his care plan, which takes time because Akhilesh's needs are complex, but they had been patient and supported me well to this day.
I agree. The carers had been very helpful for Akhilesh and almost became part of this family over the years. Would you like to give any advice to parents about care plans in general?
There are few things which I wanted to share with other parents, which I think is good to be aware of if in case it becomes useful at some point like it did for me, including reviewing care plans, power of attorney, do not resuscitate or DNR, deprivation of liberty of dolls, yellow clinical waste bins, and disabled car parking bay requests. It's important to review care plans on a regular basis because needs can change from time to time for a child. In Akhilesh's case, the healthcare professionals would reassess his requirements every few months. Before your child reaches the age of 18 years, consent from parents is taken, but once your child becomes an adult and does not have the mental capacity to make decisions, then other healthcare professionals also are involved in making decisions for them. Power of attorney is something which I also wanted to advise for parents in cases where parents may feel that their decisions are not voiced when making decisions for the care of their child. A power of attorney is useful in these circumstances, and you won't feel alone when other healthcare professionals are making decisions for your child because they are entitled to include you in this process if they have not already. Do not resuscitate or DNR is a sensitive topic for parents if it applies for your child. If resuscitating your child would result in a very poor quality of life afterwards, then doctors may consider a DNR. It is best practice to discuss with your family and doctors when considering a DNR for your child. Deprivation of liberty safeguards or DOLS is a legal framework for people who lack the mental capacity to consent to be accommodated in hospital or care home. It is designed to allow hospitals or care homes to legally authorize restrictive care situations for those who cannot consent for them. DOLS is useful in cases where parents would like to give consent or not on behalf of their child about their place of accommodation when there is conflict between the government's decision as to where to place them. Disabled car parking permit is useful for parking, but we can also apply for a disabled car parking bay to be placed in front of your home if necessary. For example, in Akhilesh's case, we struggle to park our car in front of our home because our street is busy. We sometimes don't even find enough space to park our big car, which is specially designed for his wheelchair and has a electric ramp, and so it takes more space than a normal car parking space. We would end up parking from home, which had become difficult for Akhilesh's transportation. Finally, if there is a lot of clinical waste, such as personal protective equipment or PPE like gloves and masks, then you can apply for a yellow clinical waste bin. This is sometimes useful if there is a lot of clinical disposal and your other bins are getting filled up quickly because of this waste. There are also other options such as applying for another bin or a larger bin. But if there is a lot of clinical waste in a particular, then you can apply for this through GP referral. In some counties, the district nurses or the council can provide you the bins and waste collections.
Thank you, ma'am. That was a lovely advice for parents. Something which I'll keep in my mind too. Reassessing care plans is important because, as my mother mentioned, circumstances and requirements may change over time, and so we need to act in their best interests. A child's mental capacity may also change, and they may start to communicate their needs, so we would change the care plan according to their personal wishes instead of us. With regards to applying for a power of attorney, DOLS, disabled car parking bay, and a yellow clinical waste bin, please read through your local council or .gov.uk website to check how to approach these applications, since it may vary from one county to another. If you would like to further discuss about DNR, then please discuss this with your registered general practitioner or GP. Finally, I would like to quickly touch upon the Mental Capacity Act, which my mother had mentioned in this podcast. Mental capacity means the person's ability to make a decision on his or her own. If a person aged 16 years or over lacks mental capacity, then the Act helps everyone caring for that person to make decisions for them in their best interests. There are 5 principles of the Mental Capacity Act when assessing capacity. Number 1, they must assume to have capacity unless proved otherwise. Number 2, all practicable steps must be taken to help someone make a decision before they can be assessed as lacking capacity. Number 3, an unwise decision does not in itself indicate a lack of capacity. When acting or making decisions on behalf of someone lacking capacity. Number 4, any act or decision must be in the person's best interests. And number 5, any act or decision should aim to be the least restrictive option. We have now come to an end for episode 4. Thank you for listening. We hope you enjoyed this episode and maybe giving you good awareness of the facilities socially available for people with learning disabilities, as well as some tips, hints and advice for your child's care plan. Please do join us again in our next and final episode, where we will be talking about how Akhilesh is now and his future outlook. Hello again, and welcome back to Loving Akhilesh, Reflections of Parenting a Child with Severe Learning Disabilities, episode 5. In the last 2 episodes, we talked about Akhilesh's health and social care plan, including the multidisciplinary and holistic approach from healthcare professionals, and my mother's personal advice about care plans in general. In this episode, we will be discussing about how Akhilesh is now during the COVID pandemic situation. Mum, can you please describe how Akhilesh's current status is?
We are blessed for Akhilesh turning 25 years old this year, and his care had become complex due to his medical conditions becoming worse gradually over time. He has grown tall and still requires at least 2 people for assistance in his personal care and day and night. In terms of feeding, he continues to take mashed up food added with thickener for consistency to help him swallow his food and drinks. His breathing problems had gotten progressively worse, which made him become prone to chest infections and takes antibiotics at least once a month. His epileptic seizures had also increased in frequency to 2 to 3 times a day, so we had increased the doses for his anti-epileptic medication. He is bedbound and wears diapers, which need to be checked regularly since he cannot communicate if he is wet, and needs to be quickly changed, or else he would feel uncomfortable and this would trigger into a seizure. In terms of his sleep routine, he has to be positioned in a certain way with the pillows placed in certain positions. Sometimes I would need to shift to his sides to avoid pressure sores and for his comfort. He is otherwise a happy child and still enjoys going out, playing games, watching movies and more. He cannot travel far distances and struggles to stay in other places if there is a poor wheelchair and hoist facilities. He is also prone to getting seizures when there is a sudden and high-pitched sound, or when it is too hot or cold for him. He still interacts with other people and recognizes some people and their voices, especially my daughters, my husbands and myself. He can still express his happiness and sadness with laughs, smiles, cries and tears, despite not being able to communicate or understand. He has grown into a handsome young man.
Thank you, Mum. It's amazing to watch Akhilesh grow into an amazing adult. How did you manage Akhilesh during the global COVID pandemic and lockdown?
During the COVID lockdown, we had been advised to self-isolate as advised by the government. This was a difficult time for us because we sometimes struggled with resources for his daily living and carer support. NHS provided food service where they would drop off foods at time, which was very kind and generous of them. We were even isolating a few weeks after the lockdown as advised by the government because he is clinically vulnerable to catching the virus. Since COVID started, we were worried about Akhilesh because of his healthy and vulnerability. We also stopped carers support for 1 year, and it was just myself and my husband taking care of Akhilesh, which was difficult at times, especially when one of would become unwell. Doctors would advise or prescribe over the phone when necessary, and any outpatient consultations were also done over the phone instead of going to the hospitals. Sometimes the doctors or nurses would carry out home visits like taking blood tests or to assess his health when he was unwell. We restarted carer support again at the beginning of this year. They would carry out all safety precautions when supporting me in taking care of Akhilesh, such as wearing gloves and masks, keeping the room hygienic by changing his bed sheets daily, as well as taking weekly COVID tests to ensure that they are negative before coming to Akhilesh. When the vaccine were introduced, we were all fully vaccinated straight away as well. Because we were still self-isolating, Akhilesh didn't step outside for over a year. We decided to have a patio done in our garden so that he could at least go into the back garden for him to enjoy outdoors. We even arranged sensory play and a large TV in his room for playtime at home. As soon as the restrictions were lifted for Akhilesh, we started to back to our usual routine again.
Thank you, Mum. The pandemic has impacted on everyone in some way or another, and with Akhilesh, I remember him going through this difficult phase until the lockdown measures were lifted. What would be your takeaway home message to our listeners be, Mum?
Having a child with learning disability is no less than a child without it. Since the past 10 years, there had been advancements in the resources available for taking care of a child with learning disabilities. As mentioned in the beginning of this broadcast, as Kevin Heath says, as our kids grow, they may forget what you said, but they won't forget how you made them feel. And another one of my favorites, if a child can't learn the way we teach, maybe we should teach the way they learn, by Ignacio Estrada. I hope this podcast has given you a good insight into the resources and facilities available for a child with learning disabilities to help create a good social, healthy, and mental environment for you and your child to enjoy as a family. I would like to also highlight the importance of parents taking breaks to spend time for themselves. It is important to take rest and maybe do something you personally enjoy too, like going on holidays or meditating. Sometimes we may lose ourselves in taking care of our child, so it is vital that we take breaks to help rest our body and mind and rejuvenate. Thank you for listening, and I hope you enjoyed the podcast as much as we did creating it.
Thank you, Mum, for kindly sharing your parenting experience with Akhilesh and giving advice throughout this podcast. We have now come to an end for episode 5 and also came to an end to our podcast series. Thank you for listening. We hope that you had enjoyed the podcast and hope we had given you a new light to see the world of parenting a child with learning disabilities and maybe gained a few tips, hints and ideas, as well as learned something new about the medical conditions explained in these series. I would like to now end the show with one of my favourite quotes by Robert Hensel. There is no greater disability in society than the inability to see a person more. Thank you and goodbye.